Here's the podcast script. The New York Times is reporting that Ebola symptoms in the current outbreak may be milder than in previous ones, and while that sounds like good news, public health experts say it could actually make this outbreak far harder to contain. Let's break down what's happening. The Democratic Republic of Congo is in the middle of an Ebola outbreak that was detected in mid-May. As of now, Congo's health ministry says more than 1,000 people have been sickened and more than 250 have died. But public health experts believe those numbers are likely much higher, because the outbreak may have been spreading undetected for months before anyone caught it. Here's why it went unnoticed for so long. The virus driving this outbreak is called Bundibugyo, and it's distinct from the strain called Zaire, which caused the devastating 2014 West Africa epidemic that killed more than 11,000 people. With the Zaire strain, roughly half of patients developed the horrific bleeding symptoms that Ebola is infamous for: blood vessels breaking down, organs failing. But with this Bundibugyo outbreak, the World Health Organization says roughly 90% of patients are not reaching that stage. They're getting sick, but the illness looks a lot more like malaria, typhoid, or dysentery, the kind of thing people in Congo deal with regularly and might just try to wait out. That's the paradox at the heart of this story. Milder illness means fewer people are dying, and that is genuinely good news for patients. The overall mortality rate here appears to be below 30%, compared to the 80% or higher you can see with Zaire Ebola when there are no vaccines or treatments available. But milder illness also means people who are infected keep going about their lives, going to markets, visiting family, seeking care from traditional healers or small local clinics, without ever suspecting they might be carrying Ebola. And that makes tracing and stopping the virus extraordinarily difficult. Dr. Nahid Badilia, director of Boston University's Center on Emerging Infectious Diseases, put it plainly: "It makes total sense to me now how this was missed for months." Contact tracing numbers tell the story. Normally, when someone tests positive for Ebola, public health workers expect them to name anywhere from 15 to 40 close contacts who might have been exposed. In this outbreak, patients are naming just 5 to 8 contacts on average, and only about half of those people have actually been found. Dr. Craig Spencer, a public health expert at Brown University who has treated Ebola patients, described those missing contacts as out there continuing to spread smaller fires, each one of which can blow up into something much bigger. There are also 4 unresolved clusters of viral hemorrhagic fever, one in Burundi, one in South Sudan, that researchers believe may be connected to this outbreak. If they are, the virus has spread far more widely, and for far longer, than the official numbers suggest. The situation is made worse by what's happening on the ground. Many patients are arriving at hospitals only when they're near death. Some believe their symptoms are from malaria, or witchcraft, or poisoning. Others fear that if they go to an Ebola treatment center, their organs will be harvested. Health workers are among the hardest hit. At least 18 have already died, and some who got sick earlier in the outbreak may have gone undiagnosed because the symptoms look like something else entirely. And the health system trying to fight all of this was already fragile before this outbreak began. Most small clinics in the affected areas lack even basic protective gear like gloves. The larger treatment centers in Ituri province are better equipped, but experts are increasingly worried about neighboring North Kivu province, where testing and resources are extremely limited. Dr. Chikwi Hakwizu, executive director of the WHO Health Emergencies Program, summed up the concern: "That's really what I'm a bit anxious about, that this might be an indicator for an outbreak that lasts a lot longer. This is a situation that demands urgent attention, and the world is watching closely." Reporting by Apoorva Mandavili and Declan Walsh of the New York Times.